number of scans that are required for pregnant women. So usually the first scan, that is when you miss your period and you consult the doctor, an initial scan is done. This is to rule out, to know where exactly the pregnancy is located, if it is inside the uterine cavity or outside the uterine cavity. So those that are outside will not salvage and will have to be removed or managed medically. So this is very important that the first scan is usually done to know the location of the pregnancy. The subsequent one usually is done at around 8th to 9th week to know about the gestation, how many weeks the pregnancy is, which will help in the dating so that we know when exactly this patient is going to be delivered. The third scan will be at around the 11 to 14 weeks, ideally between 12 to 14 weeks, and this is called as the NT scan or the nuchal translucency scan, or nothing but looking for defects in the fetus as early as possible. The subsequent scan will be at the 5th month, that is, it's called as the TIFA or the targeted image for fetal anomalies. So this is done say around starting from 19th week till about 22 to 24 weeks of gestation. And then after that we do something called as a growth scan. Growth scan is usually done at around 28 to 30 weeks to know how the baby has been doing in the last 7 months. And then if everything goes well, we might require another scan say at around term just before delivery, say around 37 to 38 weeks to know the fetal well-being. These are the most common scans that we usually do. In case there is any problem, say you have bleeding or you're not feeling the fetal movement, so the baby is not growing well, or the fluid is less, or there's some issue, then we might have to do it more often. Thank you.